Well, in fact, what's happening with the medical school and the health science center and the hospital as a whole accounts for why it is that, at least in part, why I'm stepping back or offering to step back into the public realm. The truth be known, my wife and I have enjoyed, these 9 months of not being subject to upholding a public trust or being inside the fishbowl that places you in. But as I sit back and I see what's transpired, especially as I saw the whole contractual process go forward, I know as the former mayor of this city, I would have had no expectation that my city council would have authorized me to sign a contract with 50 blank pages with absolutely no due diligence, with no complete and thorough examination of evaluation of exactly what we're doing, and clear explanations both to them and the public for why we're doing it and how we're doing it, and most ideally doing so in a way that allows for competition. But for whatever combination of reasons, that's what happened. And most of our folks here who represent us presently had very little to say about it. To those of us who were a part of their fellow community of elected officials, and more importantly, to the public as a whole. And so that is one of the things that motivates me to want to go and get back engaged and get back involved, so that I'm not relegated, as we are as citizens, to receiving information as those who sit on high deem it appropriate to pass along to us, but to be able to actually be in the room, have a seat at the table, be a part of the process, and to fight for something that represents one of the biggest and most important assets that we have in this community, as identified by the Shreveport Cattle Master Plan 2030. My administration allocated, I think, somewhere now north of $600,000 to do a comprehensive infrastructure master plan for how we improve the infrastructure around that facility, all with the vision of trying to do a public-private partnership that further enhances and grows and develops that as a anchor institution. The whole concept of eds and meds and what that means in terms of being able to create opportunity, jobs, and generate wealth. And so that's one of the reasons as to why I'm here before you guys today, because from my perspective, I see that institution in great danger. And much of it has to do, from my perspective, with selfish motivations that don't serve the interests of the people who most need it, and that's those who require indigent care. And then above and beyond that, the doctors who are trained there, the research that are done, the jobs that can come about, and again, as I said, ultimately the wealth that can be created that helps to enhance and elevate the entirety of the community.